Hi everyone! Welcome to Tangerine Planet, a place for kind thoughts, smart ideas, and a little sunshine for the world. Let's make a difference, one step at a time, together.
Okay, let's unpack this. Imagine there's a powerful prescription for better health. A treatment so effective, so fundamental, that doctors are beginning to, well, recognize it as a critical part of healing. But here's the thing. You won't find it in a pill bottle.
Right.
You can't get it with a swipe of your insurance card at the pharmacy counter. So what is this revolutionary treatment? Well, it seems it's rooted in something incredibly simple, something deeply human.
Connecting with other people.
Exactly.
That's the fascinating idea at the heart of what we're diving into today, isn't it? It kind of challenges our conventional notions of medicine.
It really does.
Suggesting that maybe some of the most profound healing doesn't solely come from, chemical compounds or surgical procedures, but from addressing our most basic biological and psychological needs.
That need to belong, to interact.
Precisely.
And that's what this deep dive is all about. We're exploring a really compelling article from CNN. It's a deep dive in itself, really, based on interviews with journalist Julia Hotz about her book, The Connection Cure.
Right, I saw that. She explores this emerging movement, this concept that's gaining real traction in healthcare circles, called social prescribing.
Social prescribing. We'll get into what that means exactly.
Yeah, and the article sets the stage pretty clearly by highlighting a reality that I think many of us feel, perhaps without even fully articulating it. Americans are spending more and more time alone. And the source material points out that this trend isn't just about the profound issue of loneliness, although, that's a huge part of it for vast numbers of people.
Sure, of course.
It's also about an increasing prioritization of solitude, maybe because of, the sheer exhaustion and burnout of modern life, or just the way our days and communities are structured now compared to, say, previous generations.
Right, so you have this big societal shift towards more isolation happening.
Yeah.
At the same time as another massive, really complex challenge in the U.S., the healthcare system. And the article, it doesn't pull punches here. It describes it as expensive, complicated, dysfunctional, even bordering on broken.
Yeah, that sounds about right.
It points out that despite these incredibly high costs, we're not necessarily seeing, the health outcomes you'd expect.
No.
And there's just glaring unevenness in access. Huge disparities in health across different groups. It's a system under, immense, almost unsustainable strain.
And this is precisely the intersection where social prescribing emerges as a potential lever for change, maybe, a potential solution that could tackle both of these critical issues.
Both isolation and the system strain.
That's the idea. The core concept, as Hotz lays it out, is kind of revolutionary in its simplicity: to formally integrate community activities, genuine human connection, and even environmental factors into healthcare referrals.
So not just pills and procedures.
Exactly. It's seen as a way to address both the significant, and they are well documented, health consequences of isolation, and potentially ease some of that overwhelming pressure on the conventional clinical healthcare system.
Okay, so our mission for this deep dive is to really unpack this whole idea. We're going to explore what social prescribing is, specifically how it works according to the source, look closely at why it seems to be gaining traction now in particular.
Yeah, and the evidence, too. What does the article say? Supports its efficacy.
Right, the evidence, and understand how it connects to that absolutely fundamental, biological, deeply human need for belonging we mentioned.
We'll pull out the key insights, maybe some surprising facts, and some of the compelling stories shared in this CNN piece.
Yeah, just to help you understand exactly what this growing movement is all about and why it matters to your health and maybe the health of your community.
You could think of it as sort of expanding the definition of healthcare itself.
How so?
Moving beyond just treating illness within the body, and starting to recognize and actively engage with the profound impact of our environment, our relationships, our sense of purpose, on our overall health and well-being.
Okay, so let's start right at the beginning then, the core definition. What exactly is a social prescription? Because when you hear that term, it sounds very official, very medical.
It does, doesn't it?
Yeah.
And maybe that's intentional, to give it some weight. But the definition from the source is key. It is a healthcare referral, yes, just like a doctor might refer you to a specialist or for a stand. But crucially, it's not a referral for medication. It's a referral for activities and resources that exist right there accessible, hopefully, in your community.
Okay. So that's the fundamental shift. Instead of the interaction ending with the doctor writing a script for, say, an antidepressant.
Right. The healthcare provider might now suggest something completely different. They might recommend you join a walking group in a local park, maybe sign up for a pottery class at the community center.
Or volunteering somewhere.
Or volunteering at a food bank. Yeah. Or connecting with a specific support group, or maybe a nature conservation club. It's about broadening the therapeutic toolkit, the options available.
And the article is quite specific about the kinds of activities typically involved, the ones that seem to have the most positive impact.
Yes, Julia Hotz identifies these as the core components. She calls them the pillars of connection later in her work.
Pillars. Okay.
These are movement, art, nature, service, and critically, some element of belonging woven throughout all of them.
So it's about actively engaging with the world outside the clinic in ways that nourish more than just the physical body.
Exactly. Now, it is absolutely vital, and the source makes this point with real emphasis, that social prescriptions are not intended to replace conventional medicine.
Okay, that's important.
Very. This isn't proposing that someone just stop taking necessary medication or forego essential surgery or therapy. It's not an either scenario at all.
It's a both-hand situation.
Precisely. They are explicitly meant to complement traditional treatments, medications, therapies, surgeries, physical therapy, all of that. The goal is simply to put more options on the table for both patients and doctors, recognizing that sometimes the most effective path to wellness involves multiple approaches working together.
That example Hotz uses is so clear. You can absolutely take your prescribed antidepressant, which addresses the neurochemical side of depression.
Right.
And you can also decide to take a walk with friends, which addresses the physical activity, the social connection, maybe getting out in nature.
And both can help. Often, they can even amplify each other's positive effects. It's not about abandoning one for the other. It's about integrating the social and activity components to potentially enhance the overall treatment plan, leading to maybe more sustainable well-being.
Okay. So why is this gaining momentum now? What's the fundamental why behind it?
Well, it seems rooted in a truly powerful statistic cited by Hotz in the article. She states that social determinants, these are factors completely outside the doctor's office, like our environment, our relationships, community involvement, socioeconomic status, access to healthy food, safe housing, all that stuff.
Okay.
These factors account for a staggering 80% of our health outcomes.
Wait, 80%?
80%. Let that number sink in for a moment.
Wow. So most of what determines our health happens outside the clinic.
According to this statistic, yes. We spend the vast majority of our healthcare focus, our research dollars, our medical training, on the remaining 20%, the clinical interventions, genetics, the pathophysiology of disease within the body.
Right.
But the source is saying that 80% of what determines whether we are healthy or sick, whether we live a long life or die prematurely, lies in these external, social, environmental factors.
So when you put it like that,
it makes total, undeniable sense, as the article says, that incorporating community engagement, environmental factors, social support, using those as a healing modality just makes sense.
If what's happening in our lives outside the clinic has such a massive impact,
shouldn't healthcare systems start acknowledging that, measuring it, actively engaging with those factors as a primary part of care, not just an afterthought?
It feels like a necessary paradigm shift.
It really does. Moving from an almost exclusively biomedical model, which focuses mainly on the disease inside the individual,
It's just something broader.
to a biopsychosocial model, one that acknowledges the individual as part of a larger ecosystem, relationships, community, environment, and how that ecosystem profoundly influences their health trajectory.
It's recognizing that where you live, who you live with, how connected you feel, how you spend your time, that's just as crucial, maybe more so than your cholesterol levels for foundational well-being.
That seems to be the argument, yes, at least in terms of that huge 80% chunk of outcomes.
Okay, so that statistic on social determinants immediately brings us to the second major point the article emphasizes, the high cost of disconnection. Why does this matter so much right now?
Well, the source paints a pretty clear picture, one many of us might recognize. Fewer nights out with friends, maybe more takeout eaten alone on the couch.
Less spontaneous interaction.
Less participation in group activities like, say, theater going or local clubs. Americans are demonstrably spending more time alone than they used to.
Is it loneliness or something else?
Well, the article acknowledges there's a debate there. Is it a true epidemic of loneliness where people crave connection but lack it? Or maybe, as some suggest, a century of solitude where people are actively prioritizing solo time, maybe due to burnout overstimulation, or just valuing personal space more.
But either way.
But regardless of the why, the fact remains consistent in the data presented. We are, on average, spending significantly more hours isolated from others compared to previous decades.
And this matters so profoundly because, why again? Our wiring.
Exactly, our fundamental wiring. The source is absolutely clear, and this is backed by a lot of science, evolutionary biology. Psychological humans are inherently social creatures. Our well-being, our ability to thrive, is absolutely dependent on belonging.
It's not just a preference, like liking chocolate.
No, it's presented as a biological necessity, as fundamental as needing food or shelter. And too much solitude, whether it's chosen or imposed for whatever reason, comes with significant, measurable, and concerning health consequences.
Okay, let's talk about those consequences, because this is where the deep dive gets, frankly, a little alarming.
It does. The article details these consequences of loneliness and social isolation, and they are severe, wide-ranging, impacting both physical and mental health profoundly.
Like what specifically?
If you are chronically lonely, the research cited shows you are significantly more likely to die prematurely.
Prematurely, okay.
You are more likely to experience clinical levels of anxiety or depression.
Makes sense.
You're more likely to develop dementia or cognitive decline later in life.
Really, dementia too?
Yes. And you are more likely to end up needing acute care, specifically showing up in the emergency room more frequently than people who feel well-connected.
These aren't minor things. These are major, life-altering, life-shortening impacts.
Absolutely. And to make the severity really hit home, the source uses a powerful analogy, one that's absolutely crucial to grasp.
What's the analogy?
It compares the health consequences of chronic loneliness and isolation, all that increased risk of premature death, mental health issues, cognitive decline, increased healthcare use.
Yeah.
It compares it to a habit we all know is bad for us. Smoking.
Smoking.
The consequences of all that disconnection are roughly equivalent to smoking 15 cigarettes a day.
15 cigarettes a day. Wow. I mean, a pack is 20. So being lonely is almost like being a pack-a-day smoker, health-wise.
That's the comparison the source makes. Just think about the public health effort around smoking. Graphic warnings, bans, cessation campaigns.
Billions of dollars, decades of work.
And to think that the lack of social connection carries a health burden on that same scale, it's staggering. It completely reframes social isolation, not just as an unfortunate emotional state, but as a profound physical health risk factor.
On par with major behavioral risks we've spent decades fighting. That really changes how you think about it.
It really hammers home that biological imperative for connection the source discusses.
So why are we retreating? Why the trend towards more alone time if it's so bad for us?
Well, the article suggests, pretty reasonably, I think, that life is just exhausting for many people right now.
Burnout is real.
Totally. Burnout from work, from information overload, the sheer pace of modern life, and even digital media, which seems like it connects us.
It doesn't always feel connecting, does it?
Often it can leave us feeling more drained, more anxious, less genuinely connected. The core idea presented is that we weren't really wired, evolutionarily, for the conditions modern life often demands. Conditions that encourage retreating into private homes, engaging mostly with screens, minimizing that unscripted in-person community stuff.
Which brings up that interesting point the source makes about online versus in-person connection. It's not all bad online, right?
No, and the article is careful there. It acknowledges that for some people, online connection can be a genuine lifesaver.
Like who?
Think about individuals with limited physical mobility who can't easily leave home, or people in very rural areas, or maybe those who feel isolated in their local community because they're different in some way, identity, belief, lifestyle.
For them, online spaces can be crucial.
Absolutely. Vital, connection, support, a sense of belonging they might struggle to find offline.
But there's a but.
There is a but. The source argues that most online interaction, especially the kind on big social media platforms, probably doesn't provide the kind of connection that is truly restorative for the majority of people.
It might offer breadth, lots of connections.
But it often lacks depth, authenticity, and maybe that specific kind of embodied presence that seems necessary for genuine well-being.
So what is that quality connection the source talks about? The kind that is restorative?
It's described as providing specific feelings. A sense of inclusion, feeling seen and affirmed for who you genuinely are, a true felt sense of belonging where you're accepted.
It's deeper than just likes.
Much deeper. The source suggests that forging a real connection, one of quality and depth, leaves you feeling not just less alone, but actually like you know yourself better after spending time with that person.
Like they reflect something back to you.
Exactly. Something that helps clarify your own identity or values.
And this is contrasted with more superficial interactions.
Sharply. The source posits that, spending time interacting briefly with 10 people you don't know well online or just in passing might actually be significantly less beneficial for your health and well-being than spending dedicated quality time with just one person you have a deep, meaningful connection with.
So quality over quantity, depth over breadth.
That's the key takeaway. It's about the feeling of belonging and being truly seen, not just the number of contacts or followers.
Okay, so if quality connection, rooted in belonging, is this vital, how does social prescribing actually foster that? This brings us back to those 5 pillars you mentioned.
Right. Movement, nature, art, service, and belonging. And the source doesn't frame these as, optional extras or just hobbies.
It frames them as
requirements for life itself, not just nice add-ons.
requirements. That's strong.
And the evidence, she argues, comes precisely from how profoundly our health improves when we regularly engage in them.
Okay, let's dive into those benefits a bit more. What does the article say specifically? Let's start with movement.
Okay, movement. Engaging in physical activity, walking, dancing, sports, whatever, does more than just keep us physically fit, obviously.
Right, endorphins and stuff.
Exactly. The source points out it releases key neurochemicals like serotonin and endorphins, those feel-good chemicals that impact mood. But also it improves hippocampus function.
The hippocampus, that's memory, right?
Memory, learning, and emotional regulation.
Yeah.
So movement is directly impacting brain health, not just mood or muscles.
Okay, next pillar, nature.
Nature. Spending time outdoors, a walk in the park, gardening, even just sitting under a tree, has remarkable effects on our cognitive state.
Like clearing your head.
Yes, the article mentions it restores attention and focus. And it highlights some studies, this is pretty striking, that have shown effects on par with taking stimulant medication like Ritalin for improving focus, particularly in individuals with attention deficits.
Wow, being in nature could have effects like Ritalin.
That's the comparison drawn in some research cited. It's a really provocative idea, isn't it?
Yeah.
That nature itself could be therapeutic in that way.
Definitely. Okay, pillar 3, art.
Art. Engaging in creative activities. Painting, music, writing, theater, whatever form it takes, is highlighted for its ability to reduce anxiety and trauma symptoms.
That makes intuitive sense.
It does, and it aligns with the long cross-cultural history of humans using storytelling, visual art, music as ways to process difficult experiences, express complex emotions, build resilience. Art gives us a nonverbal channel for things that are hard to put into words.
Okay, and the last 2 pillars were service and belonging.
Yes, and the source highlights these as perhaps the biggest or most impactful pillars.
Why biggest?
The reason ties directly back to our evolutionary history. Humans didn't survive as isolated individuals, right?
Sure.
We survived and thrived in groups, in communities, through interdependence, cooperation.
Our whole species is built on that.
Exactly. Our very existence is built on that foundation of social connection and mutual support. And providing service to others is a powerful way to solidify that connection and find a sense of purpose within the group.
And the source contrasts this deep wiring for groups with our modern habits.
Yeah, with the modern trend where when our health starts to suffer, when we feel stressed or unwell, our default response is often to retreat further, to isolate ourselves, to choose, as the article puts it, artificial and often electronic sources of connection, or just passive consumption over active engagement.
And predictably,
That's precisely when our health tends to suffer even more. It creates this negative feedback loop.
the idea that belonging itself is healing. Is there specific research on that?
Oh, yes. The article mentions a landmark study, the Harvard Study of Adult Development.
Ah, I think I've heard of that one. It followed people for a really long time.
Decades. Over 80 years, tracking the same individuals, all sorts of data points about their lives, health, relationships.
And the key finding?
Astonishingly simple, yet incredibly powerful. The strength and quality of your close relationships is the #1 predictor of health and longevity.
Number 1, more than wealth, more than cholesterol.
More than wealth, social status, even cholesterol levels in middle age, according to this massive long-term study. It was a quality of connections to other human beings that mattered most for a long, healthy life.
That single finding really demands we rethink our priorities, doesn't it? Individually and as a society.
Absolutely. Which brings us back to how social prescriptions actually work to foster this healing sense of belonging.
Right. How do they do it?
By connecting individuals with activities that align with their existing interests, values, needs, these prescriptions create opportunities for meaningful connection.
Meaningful is the key word there.
I think so. It's not just about being in the same room. It's about engaging in a shared activity that is intrinsically compelling to that person. That intrinsic motivation makes engaging much more appealing, more sustainable, than just being told to go socialize or finding generic reasons to leave the house.
And it's not about forcing interaction.
No, absolutely not. The source stresses the goal isn't to force people into some awkward artificial kumbaya circle with strangers.
Thank goodness.
It's about helping individuals reconnect with activities and types of engagement that genuinely matter to them. Maybe it's restoring antique cars, or bird watching, or knitting, or political organizing, or trail running, whatever it is.
Finding their people.
Exactly. Helping them find others who share that interest or passion. And through that shared activity, authentic connection and a sense of belonging can naturally emerge. It's about reconnecting individuals with what gives their life meaning and purpose, and doing so alongside others.
Okay, so how is this actually put into practice in a clinic, say? You mentioned personalization is key.
Yes, the source emphasizes that repeatedly. Personalization is absolutely key to social prescribing's effectiveness. A doctor can't just hand everyone the same list of local clubs.
It wouldn't work.
Probably not very well. It works because the referral is tailored to the individual patient's specific circumstances, their interests, their values, their abilities, their goals. It requires a deeper conversation than just writing a drug prescription.
There was a great example in the article about this. Dr. Zoffness, the pain psychologist.
Yes, Dr. Rachel Zoffness.
Yeah.
She uses a really vivid and simple analogy with her patients dealing with chronic pain. The pain dial.
The pain dial. Tell me more.
She asks patients to visualize their pain, not as this fixed, unchangeable thing, but as a dial, like on a radio.
Oh.
A dial that can be turned up or down.
Okay.
Negative emotions, sadness, anger, stress, trains, they can turn that dial up, intensifying the perception of pain.
Makes sense. Pain feels worse when you're miserable.
Exactly. But, she explains, other things can actively turn the dial down. And one powerful way to turn it down is through distraction, getting so absorbed in something that the pain just recedes into the background.
Losing yourself in an activity.
Precisely. So she works with her patients to help them identify activities that serve as powerful distractions for them, things that make them forget about their pain, times when they've gotten so absorbed they completely lost track of time.
So she's helping them find their own social prescriptions.
Essentially, yes. What activities in their community or their past or maybe their potential future might serve to effectively turn down that chronic pain dial by engaging their mind, body, and potentially connecting them with others who share that interest.
And the source is clear that there's growing evidence this works for various conditions.
Yes, growing evidence of efficacy. For these types of social prescriptions and engaging in these pillars of connection across a range of diagnosed conditions.
What kind of conditions?
The article lists examples like helping manage symptoms of ADHD, reducing the impact of chronic pain, potentially slowing cognitive decline in dementia, and of course, directly addressing the health consequences of loneliness itself.
And exercise specifically.
It specifically highlights that engaging in regular exercise, a key part of the movement pillar, is a well-established treatment. It can help manage and treat depression disorders, stress, anxiety, and even metabolic conditions like type 2 diabetes.
So the science is there for the components.
The argument in the article is that by solely focusing on pharmacological or procedural interventions, conventional healthcare systems are kind of missing the boat. They're missing the profound impact that meaningful interaction, community engagement, and these basic pillars have on health outcomes. They're leaving that huge 80% of social determinants largely unaddressed by the formal healthcare system.
The Aquila story from the source really illustrates this, doesn't it? It was quite powerful.
It really was. Aquila had suffered a back injury, resulting in severe chronic pain.
Which forced her to leave her job, right, as a caretaker.
Yes, which is clearly a huge source of identity and purpose for her. So this loss of work, combined with the relentless physical pain, led to a downward spiral, severe depression.
And she tried the conventional treatments.
Everything. The source says she tried every therapy available, took prescribed pills, even had surgery. Some things offered partial relief, but she was still suffering significantly, both pain and depression.
But then something changed.
Yes. What really marked a turning point, according to the source, was what Hotz calls an unconventional prescription.
Not medication.
Not medication. It was volunteering for a children's healthcare charity.
Ah, the service pillar.
Exactly. By shifting her focus away from her own pervasive pain and suffering and towards actively caring for others who were also suffering, something fundamental shifted within her.
And the result?
The source reports the severity of her chronic back pain significantly lessened, and her depression lifted dramatically.
That's incredible, just from volunteering.
Well, it highlights that sometimes finding a new sense of purpose, shifting focus from internal suffering to external contribution, engaging in service that connects you. Sometimes that can have a more profound and healing impact on chronic conditions like pain and depression than purely conventional treatments alone.
It shows the power of connection and purpose.
It really does. The potent, almost miraculous power that social prescribing aims to harness. It's not presented as a magic bullet, of course, but for Akilah, it seems it was the missing piece of her recovery puzzle.
So, given this potential, where does social prescribing stand in the U.S. right now? Is it happening?
The source notes that while it's much more mainstream and integrated in places with nationalized healthcare like the UK,
There's a longer history.
right, longer history, more established pathways, the movement is definitely growing here in the United States. More innovative healthcare providers, clinics, hospitals are starting to issue these non-clinical referrals.
Are there organizations tracking this?
Yes, organizations like Social Prescribing USA are actively tracking and trying to connect these various initiatives that are springing up across the country. It's gaining momentum, but maybe not fully system-wide yet.
But for you, listening right now, maybe your doctor isn't doing this yet. What can people do?
Well, the source offers practical, immediate advice. Julia Hotz strongly recommends that individuals don't necessarily wait for a doctor's referral.
Take initiative.
Yes. Start by prescribing themselves activities that align with these principles. She suggests looking for low-cost or donation-based options in your own local communities first, as these are often the most accessible and sustainable.
And she gives questions to help figure out what to prescribe yourself.
She does. Simple, insightful questions to guide this self-prescription process. Questions to help you identify what might nourish your own need for connection and well-being.
Okay, what are they?
First, what did I love doing as a child?
As a child.
Yeah, think back before adult pressures set in. What brought you pure joy? Made you feel alive? What did you do just for fun? Those are often clues to your core interest, what genuinely fulfills you.
Okay, that's a good one. What's the second question?
Second, if I had 2 extra hours in my day, consistently, what would I really spend them on?
Not what I should do.
Exactly. Bypass the shoulds, the obligations, what feels productive. What do you genuinely crave? What feels restorative? What nourishes your soul? It points towards your underlying values and passions.
Okay, child activities, extra hours, and the last one.
And finally, what makes me lose track of time?
Ah, that feeling of flow.
Precisely. That state where you're so completely absorbed that hours melt away unnoticed. That's a powerful indicator you're engaged in something deeply meaningful, enjoyable, or stimulating for you. Activities that induce flow are often fertile ground for well-being and, when shared, for forming deep connections.
So these questions are basically tools to become your own social prescriber.
That's the idea, helping you identify your personal pillars, the specific types of movement, nature, art, service, or belonging that resonate most authentically with you. The things that fill you up rather than drain you and offer potential pathways to meaningful connection.
Okay, that's the individual side. But the source also talks about a broader societal dimension, right? Something potentially darker.
Yes, moving beyond individual health benefits, the source discusses the potentially more sobering societal dimension of this widespread lack of belonging.
What's the consequence there?
The article points out a serious and concerning one. People who lack a strong sense of belonging, who feel isolated or marginalized, can become vulnerable. Vulnerable to involvement in very harmful and extreme political causes.
That was a really striking point in the article. The example used was...
Former members of QAnon.
Right.
Stories from people who've left movements like that often include descriptions of profound depression, social isolation, crippling loneliness, a fundamental lack of belonging in their lives before they got drawn in.
So the isolation created a void.
A void. A desperation for connection and meaning, which these kinds of groups can be very adept at exploiting. They offer a ready-made community, a sense of purpose, even if it's based on harmful ideas.
Is there a biological basis for why isolation makes people vulnerable like that?
Well, the source cites neuroscience research that helps explain it. Studies show people actually register social pain, the pain of exclusion, rejection, isolation in the brain, very similarly to how they register physical pain.
Social pain feels like physical pain in the brain.
It activates overlapping neural circuits. The article even notes that just witnessing social exclusion happening to someone else can trigger this neural response. That's how deeply wired we are for social connection and how genuinely painful its absence can be.
And this social pain, it leads to desperation.
It can translate into a kind of desperation for belonging, yes. This desperation, the source argues, can drive vulnerable people to find connection and identity wherever they can get it. And sometimes, unfortunately, that's in groups that, while offering a sense of belonging, do a lot of damage to individuals and to society.
So the argument is that these extremist groups are growing partly because society isn't providing enough healthy connection points.
That's the powerful argument presented. The groups mobilizing to cause harm are finding fertile ground, at least in part, because mainstream society isn't effectively providing the kinds of healthy, authentic spaces for connection, purpose, and belonging that people fundamentally need. Maybe spaces that were once more readily available through traditional community structures, churches, unions, local clubs, are weaker now.
So investing in those healthy spaces, that's the countermeasure.
Exactly. The article frames investment in fostering these other spaces for connection, actively supporting and creating local opportunities for movement, nature, art, service, belonging as a crucial way to counter this negative societal trend.
It's not just about individual health then, it's about community resilience, civic stability even.
That seems to be the implication. And conveniently, these are the very same activities that happen to be incredibly healthy for us as individuals. So it's presented as a potential win-win.
Which leads us nicely into the future of social prescribing here in the U.S. The source makes a really interesting argument here about its political appeal.
Yes, it suggests investing in this approach has a potentially rare kind of bipartisan appeal.
Bipartisan. In today's climate.
Well, that's the argument, that it's an area that can bridge divides and speak to concerns important to people across the political spectrum.
How so? What are the different angles?
Well, on the left, the article notes there are significant, long-standing concerns about healthcare access and affordability. Right.
Social prescribing offers a potentially more affordable, more accessible, more equitable path to better health outcomes for many people, especially those in underserved communities where clinical care might be scarce, but community assets, parks, libraries, local groups might exist.
Okay, that makes sense for the left. What about the right?
On the right, the source mentions movements like Make America Healthy Again. These groups often express concerns about aspects of the modern medical system. Maybe pharmaceutical safety, over-medication, the influence of chemicals in food and medicine.
So social prescribing appeals to them because
its focus on natural activities, community engagement, and non-pharmacological approaches aligns with the desire for more holistic, maybe less conventionally medicalized routes to health.
And then there are the fiscal conservatives.
Exactly. People concerned about ballooning healthcare costs. For them, the economic appeal is potentially very clear.
And this is where the source makes that crucial point. It's not just about health benefits, it actually saves money. That's the powerful evidence-based point presented. Social prescribing, by addressing root causes of illness and reducing the need for expensive interventions down the line, actually saves money over time within the healthcare system.
How does it save money?
It reduces pressure on the overburdened system, hospitals, clinics, by helping people stay healthier, manage chronic conditions better, and stay out of crisis in the first place. It shifts resources upstream, addressing those 80% social determinants before they snowball into expensive medical emergencies.
That 92-year-old example in the article really drove this home for me.
It's a perfect illustration, isn't it? Simple but effective. The source describes this hypothetical, but unfortunately all too real, scenario. A 92-year-old woman repeatedly ends up in the ER or admitted to the hospital.
Not for an acute illness, but
simply because she's profoundly isolated, lonely. She has nowhere else to go. Maybe she's experiencing the physical health impacts of that isolation. More anxiety, poor sleep, physical decline made worse by inactivity.
And those hospital visits are incredibly expensive.
Hugely expensive, funded by healthcare systems, taxpayers. But imagine, instead, a social prescription for her.
Right.
Recommending and connecting her to something simple but meaningful. A weekly phone call from a volunteer program. Securing her a spot in the local senior knitting group. Arranging for a friendly visitor. Something that directly addresses her fundamental need for connection, purpose, stimulation.
And that's much cheaper.
Exponentially cheaper. That kind of relatively low-cost intervention is going to save massive healthcare resources and taxpayer money compared to that cycle of repeated ER visits or hospitalizations driven mainly by social isolation and its consequences. It's a clear economic argument for investing in community connection.
So the source's conclusion on the future here in the U.S. is hopeful.
Cautiously optimistic, I'd say. Recognizing the profound, undeniable way our environments, communities, relationships affect our health, and actively prioritizing social prescribing as a formal part of healthcare referrals, maybe even broader community support infrastructure. It's presented as a smart, necessary investment.
An investment that improves health.
Reduces costs.
And might even appeal across political divides.
That's the potential laid out in the article. It's an approach that finally starts to acknowledge the holistic nature of health.
That we're not just biological machines that break down.
Exactly. We're complex social beings. Our well-being is fundamentally deeply intertwined with our connections to each other and our engagement with the world around us. It's recognizing that healing happens not just in clinics and hospitals, but out there in communities.
Okay, so to recap this deep dive into the connection cure, social connection isn't just, a nice-to-have emotional state.
No, it's vital. A biologically necessary human need.
With profound, measurable impacts on our individual physical and mental health, and maybe even on the health and stability of society as a whole.
And social prescribing offers a structured, evidence-backed, and increasingly recognized way to integrate this crucial understanding into healthcare. Encouraging engagement in activities rooted in those pillars, movement, nature, art, service, and belonging, that nurture those essential connections.
It represents a really powerful shift in thinking, reminding us that sometimes, maybe often, the most powerful medicine available isn't found in a bottle or on a prescription pad.
But in finding that sense of belonging, that purpose, contributing to the world around us.
So as you think about everything we've discussed today, the stats, the stories, those pillars of connection, maybe consider this provocative thought that builds directly on the source material. Given that staggering reality that social determinants account for a massive 80% of our health outcomes, what might healthcare look like in the future if we truly prioritize connection and community engagement as much, or perhaps even more, than we currently prioritize medication and clinical procedures?
That's a big question.
It is. And on a more personal level, armed with the insights from this deep dive, how might you start consciously prescribing connection and belonging for yourself, maybe beginning today?
Thanks for being with us today. Don't forget to like, share, subscribe, and tap the bell to keep the good vibes going. Let's join into healing our little world one step at a time, together. And all this is Tangerine Planet. Until next time.